Yes, thank you very much, Dr. Yap. And we also have Ms. Rebecca Look, who is the Business Development Manager of DM Asia, who will be our panelist tonight. She will be also answering questions you may have during the webinar. Before we start, a bit of housekeeping to ensure that everything is running smoothly for everyone. So there are 3 buttons on the bottom that you can use to interact with our panelists, because we are on mute to minimize interruption during the webinar. The first one will be the chat button, which allows you to type and communicate with our panelists. Say if you cannot hear them, you can always tell them there. And the next one is the raise your hand button, where you can click in case you have urgent need, or when you're asked to vote for something during the webinar, you can click there. And then the last one will be the Q&A button. You use this for Q&A only, and make sure you use it during the Q&A session at the end. We'll make sure your question is answered. Now that's it from my side, and without much ado, over to you, Dr. Yap.
Thank you very much, Vivian. Hello, everyone. It's good to virtually see all of y'all. Yeah, I wish I could see more of y'all on the screen, but because of the webinar format, I only get to see my slides. But really, thank you very much for signing in. I know this time is dinner time in this part of the world. Spending time here when there's so many things happening, I'm really grateful to see all of y'all here. So today I've been invited by DM, Dental Monitoring, just to share a little bit more about how things are at my practice and how I've been using DM during this time as well. And just 2 minutes, a short introduction, because I know there are some people joining us from other parts of the world. So I'm in Singapore. You can see the background behind me. Yep. And my practice is along in the busy shopping district, which is unfortunately not so busy now. And you see the photo, my practice is just in the corner on level 7. And just remember this building, the facade, because at the end of the presentation, I'm just going to show you another slide, and you should recognize the same slide again. In my practice, we have 2 clinics side by side. We have a clear aligner center. It's a 4-chair practice where we only do Invisalign and hygiene work and a little bit of other clear aligners, but I would say 98% Invisalign. At the other practice where I spend about half the time, it's what we call our clear aesthetic and implant center. This is where we do more of our restorative work. Yeah. Just a very quick overview of the practice, and we do have an in-house lab as well. Okay, so coming straight to my topic, because I have only 45 minutes, but I'm quite excited. There's quite a few things to share, and I'm also looking forward to the Q&A questions. So at any time you have any questions, just go down below, key your question in, and then Rebecca or Vivian will help us and will sort of interrupt me when there's interesting questions. If not, we'll leave it to the end. Basically, I'm going to cover 4 things today. And let me just quickly go and just share with you just a disclaimer first. Just to let you all know, I am being paid by DM for doing this. I'm also a speaker for Align, which makes Invisalign. I'm also sitting on their advisory board, and I'm also on their ambassador program. Okay. However, I always believe in teaching and sharing only things which I feel are really beneficial to myself and also to doctors who are practicing wet-fingered dentists. Yeah. So everything which I'm going to talk about are things that I do. If it's something that I don't do, I will definitely let you all know. Okay, so everyone is talking about this, so I'm just going to quickly run through this because I think all of us are in this together. And really, the impact is pretty terrible. I think we're hearing of many practices closing down. Even just 2 weeks ago, I had a friend in Chile, and within 1 week, he knew 10 practices closing down. Patients are afraid. Patients are frightened. A lot of them do not see the dentist, end up getting poorer health, so we end up seeing lots of emergencies. For those who are doing aligners, you find it difficult to see the patient. Patient compliance decreases because they are too worried about other things, losing their job, family, diseases. As dentists, a lot of us are now unable to perform what we normally do. And ultimately, because most of us business do not have that much cash, and being locked down for 4 weeks to 6 or even 8 weeks, a lot of us are at risk of basically closing. Yeah. Of course, for our international audience here, they were asking what's happening here in Singapore. So we were very lucky in the beginning. We had good control. But unfortunately, in the last 2 weeks, the number of cases here has spiked quite a bit. So right now, I just announced today our circuit breaker or our lockdown, okay, has been increased by another 4 weeks. So there's still 6 more weeks to go. So during this time, the next 6 weeks and the past 2 weeks, I've only been able to provide so-called pain relief. Yeah, we are only to do emergency services, only if patients have severe pain, swelling, or infection. Yeah. Almost all the shops are closed. Schools definitely closed. Restaurants are closed, so you can only do takeaway. And some supermarkets still remain open. You need to wear a mask all the time unless you're exercising and you are jogging. And oh dear, McDonald's is closed. It's probably the most terrible thing happened to a lot of people. Yeah, I put that as a bit of a joke. But yeah, this is now very common. Everyone sees this social distancing, special places for you to stand in the train. And this is where I practice. You can notice this is the busy Orchard Road. Normally it's full of people. You can hardly see anyone now. And when I'm driving home yesterday, you can see the roads are totally empty. So yes, times are really interesting now. Update, we have close to 10,000 cases. And if you look at the curve, if you look at the log curve, you find that we are nowhere near the flattening of the curve yet. So it's still on the way up. So which is why it has been extended. Okay, enough about the doom and gloom. So let me just share some of the challenges that are unique in our practice and how dental monitoring has also helped us a bit. And some of it may or may not be relevant to you, but hopefully there'll be some things that you can take back today. So in our practice, main thing is that we can't see new patients. So it's down to 0, no more cash coming in. When the moment they announced the lockdown, we had to basically postpone all our non-essential cases, which is about 98%, because we are aesthetic practice. We hardly see pain or emergency cases. So now we still remain open. We are down to a skeletal crew, 1 or 2 doctors on the day, and we only see emergency cases. The Ministry of Health is very concerned with the spread, so they are also very concerned that dentists may not be following the rules. So there are also spot checks being done by Ministry of Health officers to make sure that dentists only do the minimum for their patients. So that's adding a lot of stress to dentists as well. We have to keep our distance in the office, and the extreme financial stress is definitely taking the toll on a lot of people. But I also want to share with you how the bright side of COVID, in a sense, or the bright side of all these things, is that it has actually forced all of us to really adopt or to learn new things. And I mean, for me, I've never liked to give a webinar. I always enjoy the engagement with the audience in the crowd, to be able to see the body language and the eye contact. Now I'm just looking at the camera, trying to imagine who's looking back at me. But with all things change. This is my typical clinic meeting now. This was the last 2 weeks before moving on to the skeletal crew. So some of them are actually working at home. Obviously, all still quite happy. So I'm actually getting quite good at Zoom now. And the other software which I started using before COVID, but I'm using a lot more now, is what we call Loom. It's not Zoom, it's Loom. So this Loom video allows you to record the screen and record yourself as you are talking. And I find this extremely useful during clean check or during explanation. I'll just play a very quick video so you have an idea. So what I do is that I will actually record myself explaining either the clean check or explaining certain procedures to the patients. Yeah. Dr. Ronnie here, just making a short video so that it's easier for me to maybe explain and to address that you have regarding. So you can see the audio is actually quite clear. So basically this is, and it's full-time real recording. And if you can see, so as I'm moving the cursor, so it's a little bit like a mini webinar first, for the patients. Yeah. And how the teeth are moving. I'll just turn on and I'll color the teeth grey so that you can see. Okay, I think you more or less get the idea. So, it's not so the software is free. It's called Loom. And in fact, I do that sometimes for overseas patients who have visited me. Now they're gone back, just to explain the treatment plan to them. Yeah, I like to use this rather than to use Zoom because it's just one way. So at least I know that I'm in control of my time. I spend a few minutes recording and I send the video to them. After that, then I might follow up with the Zoom just to do a Q&A. Okay, so before we go in about how I'm using the DM during this difficult period. I guess there's some of y'all, I was told that, in fact, the vast majority of those who are listening in are not DM users. So I'll just spend maybe the next 10 to 15 minutes talking a little bit more about the features of dental monitoring. And I've been using it for more than a year, actually, year and a half. And for those who are not too familiar with it, let's talk a little bit what it is all about, why I'm using it, and what are some of the clinical applications of DM or dental monitoring. Yeah. So actually, dental monitoring has three parts. Yeah. Okay. Three platforms. Let's just have a quick exploration of the platforms. The first one is your doctor or the team dashboard. So on the dashboard, this is where it's web-based. So all your patient's information, all the parameters, all the communications, all the photographs, everything is stored there. And later, I'll just run through one or two cases, and you can see how we use the dashboard to be efficient and also to communicate with our patient. Second key part of the DM platform will be the app that runs on the patient's mobile phone. This runs on both Android as well as iOS. And it's a very interesting app. It's free to actually download. And the patient interacts exclusively through the app, or they can also use Messenger, email, or WhatsApp. But with the new app and with the new upgrades, there's also built-in messaging inside. And we'll show you some examples. You can take photos, you can do drawings, and you can send it to the patient. And then lastly, of course, the backbone of dental monitoring would be what we call the AI, or the artificial intelligence, that resides in all the servers. I'm not sure where they are, but for sure the headquarters would be in Paris. I visited there, seems a long time ago. But the AI will spend maybe a short while just to explain how the AI works. So together with the AI, it interacts with the patient through the app and through the doctor, and that's where what we call a bit of the magic will actually happen. Yeah, and I'll run through some cases later to explain. A little bit about the app and how it works. Yeah, so the phone app, basically the key thing of the phone app is that it's able to guide the patient to take photos or even take videos, so that you can really monitor what's happening in the patient's mouth. And I'll just show you a short video. So you have an option of just using the mobile phone alone with the retractors, or you can also opt for the newly launched, well, not that new, about half a year, scan box. Yeah. So the scan, let me just go straight into the video. So when you see the patient installs the app into the phone, you give them the scan box and the cheek retractor. And then it's actually quite self-explanatory. Let's just have a look at the video.
And follow the instructions.
Yeah, just follow the instructions, yeah. So the patient keys in the aligner, checks the sound.
Place your phone into the scan box and latch it in. Insert the cheek retractor and snap the scan box into place.
So it
position the arch downwards. Insert one side first, then the other. You will hear a click when your scan box is properly attached to your retractor. During the scan, audio instructions will guide you through the steps. Let's go.
Double tap on the screen to start the scan. For this step, bite down on your back teeth and keep your teeth together.
Start moving your head as soon as you hear the camera make a sound.
Shift the scan box to one side. Now shift the scan box to the other side.
Make sure you move the scan box at the same rate as the progress bar. Scan all the way to the side to make sure your back teeth are well seen. You can also turn your head slightly in the opposite direction if that is easier.
Back to the center.
If you need to restart the current step, simply press the restart button.
For this next step, you'll have to keep your teeth slightly apart.
Okay, I'm just going to stop it there, because basically it just guides the patient to take the video one more time with the aligner, without the aligner, and third time with the teeth actually biting down. Yeah. Okay, let's just go on to, yeah, so this is the kind of photo that the patient is able to take using the mobile phone and the scan box. Yeah, so you can see that it's actually quite high in detail, especially with the newer mobile phones. Sometimes even better than some of the photos you take with an SLR, depending on your training. So once the photos are all taken, and then it's then uploaded automatically to the servers, and that's where the artificial intelligence is able to then collect the data, learn, And then from there, it's able to also process the raw images. Yeah. So it's actually quite smart. It's able to detect teeth, it's able to detect gums, it's able to detect color and basically inflammation. It's also able to auto-crop the images for you. And then from there, you identify where the teeth are and where the gums are. Okay, and then from there, it can automatically also identify the tooth and give tooth numbers to the teeth. Yeah. And what it can do. So once it has all this data, is then processed, then as a dentist or as an end user, we decide what we want. So remember I talked about the web-based application for the dentist, your dashboard. So it comes with lots of pre-programmed protocols already. So as you can see from this slide, these are what we call the standard protocols. You have the 14-day aligner protocol, 7 days. If you're using other brands, they got different protocols for different brands. You can even do monitoring on patients with braces. I don't do fixed anymore, but since I mentioned braces, there's a very interesting thing about DM is that it's able to track the movement of the teeth. So it will be able to alert the clinician when it knows that the wire has expressed itself fully. So that's a very interesting concept.
Sorry,
yes?
I have to interrupt.
Yeah.
We got comments saying that they cannot see your screen.
Oh, okay. Oh, really? I'm sorry. Let me just... So they saw the video, right? Let me see.
Dr. Ronnie, yes, we saw the video, but after the video, we didn't see any slides. So I don't know what we missed on.
I don't know. Okay. So are you all able to see it now?
Yes. No.
How about now? Yeah. Okay. So let me see. I'll just go back and just redo it one more time. I apologize for it. Yeah. Okay. So I think this is where I left off the video. I'll skip the video. So I just wanted to say that it's able to take extremely clear images, and I sort of briefly mentioned about the AI. So I mean, all this information, if you want, you can actually get it from your dental monitoring DM rep. Yeah, but basically I mentioned the software or the intelligence is able to detect the teeth, draw it out, and the gums. Yeah. And then this was what I was mentioning about the template and the standard template that comes with DM. Is this okay? Can you all see? Just want to check in.
Yes, perfect.
Yes. Okay. Good. Yeah. So again, more than happy for you can actually go in and click. It's a very, very comprehensive system. There's just too much for me to cover in 45-minute session. But suffice to say, I was talking about the braces, wires, meaning that we typically change the wires every 6 or 8 weeks. But sometimes we know that the wire continues to express itself for even 12 or 14 weeks. So the advantage of using DM is that you only call the patient back when the software, or rather when the AI tells you that, hey, the wire is fully expressed, time to bring the patient back to change to the next wire. So that really increases the efficiency by quite a bit. Yeah. Can I just check, am I going a bit too fast, Ryan?
No, I think it's good.
It's okay? All right, good. Yeah. So here is some of the protocols that we have actually sort of made ourselves. So you can see we have like a compliant patient protocol. We have second refinement protocol. We have this protocol for patients who have no attachments and they only wear the aligners at night, and we scan every 2 weeks. And we have a naughty patient protocol. Yeah. Okay. For those who know DM, I think this will be quite funny. Anyway, yeah. So the protocol will actually determine how the software, or rather how the app will make its decisions as well. So there are actually many, many dental situations that the AI is able to detect. Too many for me to cover. So just very quickly, just to gloss through, you can check spaces, you can able to notice expansion, how are the gums, is your appliance all right, how's the aligner, the buttons coming off, is the aligners wearing off, is it fracturing and things like that. And all the way down, even to the arch wire. Is there a loss of arch wire? Is the patient brushing well? Are there stains? Is the patient brushing the appliance well? So it's really quite comprehensive. It's like having another staff on another pair of eyes. Yeah, it can detect infection. It can also detect whether their teeth are actually moving, which is rotation, which is not part of the planning. You can also check on your tats. Are the tats still there? Are they basically dropping off? So all this is basically available. So I'm just going to sort of skip it as well. But just to basically let everyone know the kind of things that AI is able to do today. Yeah, but basically most of the time, of course, the crucial things are like looking for black triangle formation. Is the aligner sitting really well and things like that. So yeah, so that impressed me a lot when I first found out about dental monitoring and what it could do. And of course, why did I actually started using DM? So I think most of us in this who are listening in would probably be what we call aligner users, most of us. And I think aligner dentistry is fantastic. It's amazing. I really enjoy doing it, but it also has its fair share of challenges. Normally at this time, I would challenge the audience to sort of shout out to me what are the challenges they face. But of course, this being one way, I'll just, you can mentally run through what are the challenges you have and your wish list for aligner, but definitely main problem, compliance, patient compliance issue, aligner, unseat, off tracking, multiple refinements, patients who are fussy, you're not sure what's happening. You see them 4, 6, 8 weeks later, and sometimes the aligners really fit poorly, and whose fault is it? Yeah. And sometimes the patient comes in, just 10 seconds, perfect, off you go. It's kind of like unnecessary appointments in a way. You're not sure who's at fault, okay? And sometimes patients don't brush well. So these are some of the challenges that we face in our practice as well. So to me was, why not DM, since DM is able to really address all these problems. And as it is, a lot of us are wearing smart devices already. I mean, those of you who are babies, you're monitoring your babies all the time. Like it or not, we are being monitored all the time, yeah, wherever we go. This is the cameras that we find in Singapore, actually, our subway system. And for those of you who are in the millennials generation, for me, I'm already past 50, but they did a study even 5 years ago. They found that even at that time, 70% of the millennials would already be quite happy to use the app to manage their health. Yeah. And then more than 60%, more than half, even these 5 years ago, willing to share data with their health service provider. And in Asia, as part of the lecture, I actually did some research. We all love our handphones, but I didn't know that we love it so much. So in Southeast Asia, actually, on average, we spend 3 hours on the phone. Yeah, that's a lot more compared to the US, which is 2 hours, and Japan, which is only about an hour. So how can we then leverage this phenomena of the technology, wearable technology, or patients being so comfortable with technology? And of course, some of us are still kind of afraid. Is it something additional for the patient to do? Will the patient really adopt to this? Will I get resistance from them? But you'll be surprised that almost 80%, based on certain research and studies, I'm not going to cite it here, but just an infographic to make it easy, that up to 80% are actually quite comfortable to actually do virtual dental care. And we always think that those who benefit the most are those who probably can't move around, can't travel. But surprisingly, you find that it's the working people, more than half, in fact, almost 60%, 55%, actually look forward to the benefit of what we call mobile or tele-dentistry, and not being able to save time and not coming to the dentist so often. Yeah. So in summary, why we then went on to use DM, because I think it's nice to have everything able to communicate in one app. It's a lot convenient for the patient. They don't have to come by so often. It's very nice engagement, because now almost every week, if you want to, you're actually sending messages to the patient. And we know exactly what's happening, yeah? We have moved from cutting down number of appointments to what we call appointment on demand. So appointment on demand is something that we have only started quite recently, meaning that we do not give an appointment to the patient until we are ready to see the patient. That means we only see the patients virtually on DM, and we only fix the appointment when you're ready. So for me, in the beginning, the transition part, I still kept to my normal visits until I was really confident of what DM was using. And then I started to see the patients maybe half the time. And then now eventually I'm going on to what we call appointment on demand. Virtual appointment is a word that I have in my practice. It's not something from DM, and I'll share a bit about what a virtual appointment means in our practice. Yeah, and what we found out was that ever since we started using dental monitoring, we actually are saving a bit more time because we're actually tracking the cases better. We're able to troubleshoot better, and number of refinements are definitely going down. So maybe let me just go straight into some clinical examples of what we do with DM. I'll just probably spend just give 5 examples. Yeah, one, how we manage the patient. I want to talk a bit about virtual appointments as well. Troubleshooting, I think that's quite common sense. It's 1 or 2 cases. Sometimes you have problems with the aligners. DM also helps in that. Saving appointment time basically, and I will just show you one complex case where I think in the past without DM it probably taken a lot more time. Yeah. So
Doctor,
patient manage. Yes.
Sorry to interrupt you.
Yes, sure.
Coming in from Dr. Poon, she said, "Do you really give all the aligners to patient with DM?"
Sometimes patient who are paid in full. Yeah.
All right, great. Thank you.
I'm not sure whether that, yeah, I mean, it's dangerous to give all, or you keep the last 2 or the last 3. Yeah. Okay. So giving patients all aligners was something that we didn't do that often, but I'm doing a lot more. And if you stay on to the second last slide of the presentation, you understand why. Yeah. Okay. So the app itself is a built-in messenger service. And it actually is nice because whatever message you send to the patient, you have a so-called a summary of it. So it's a bit like what we call a CRM, client relationship manager software. So this is the automatic message that goes out to the patient. And of course, as a practice, you can actually customize what you want the app to say. Of course, the patient, most patients know that the initial message comes from AI, but not all the time. So in this case, the patient actually replied through the app that you wanted to change the aligners every 7 days instead of 10. Is this correct? And then we were then able to then address the patient and tell them, yes, no, you can actually go ahead. Yep. And then my staff will say, yeah, let me check with Dr. Yap and we'll get back to you. Okay, so everything is recorded there. So that's a really nice feature. Okay, let's talk a bit about virtual appointments now. So virtual appointments is kind of similar to a normal appointment. I mean, some of you see the patient every 4 aligners, some will see every 6, and some will see every 8. So although with the dental monitoring, you are actually seeing the patient every week, it'll be very exhausting for you as a clinician to sort of track every single time the scan comes in. So depending on your comfort level with the so-called application of the software, some doctors will check in maybe every 3 aligners. So for me, I normally check in every 6 aligners. But if it's a so-called very tough case, sometimes I might check in every 4 aligners. Checking in means that I would actually have a block off a session, maybe an hour or half an hour, and then I'll sit down with my DM coordinator, or some practices call them the DM champion. So the DM coordinator actually is in charge of all my DM cases. So she's the one who actually spends the week going through the cases weekly. And if there's a problem, she'll flag that out. So that's quite a standard procedure for most practices that do the DM. Whereas the virtual appointments is something that we do on our own. So during the virtual appointment protocol, I will sit down with my DM coordinator, and then she'll pull out the clean check, and then I'll look at the DM, and then I'll then compare the progress of the case as well as against the clean check, just to make sure that we are basically on track. For example, if you're distalizing, because the problem is when you're distalizing, the aligner might fit really well, but you might be losing anchorage in front because the patient is not wearing the elastics. But the aligner still fit perfectly. So the AI will still think that it's good to go on to the next aligner. Yeah, but as a clinician, it's our responsibility to check in to make sure that the 3-dimensional movements are all there. So you can see, I'm just zoning in on the upper left quadrant here. So this is what I'm seeing from the patient scan. You notice this is done by the scan box. You notice the retractors at the side are kind of gray. And the resolution is actually excellent. And then even the front, you can see all the detail, you can see the health of the gingiva, and the fit of the aligners, is actually very clear. You can see where the attachments are. So I'm then able to then pull out the clean check and compare at stage 12 of the clean check and the patient, make sure that the bite is correct. And I'm just zooming in just to show you all that what I'm seeing on the ClinCheck and what I'm seeing clinically is actually very close. So now I'm very confident that the case is actually tracking well. So I might do a virtual appointment, maybe 6 aligners time, or I might just look at the movement on the ClinCheck and I find that the movements are pretty straightforward. Then I might not even do another virtual appointment in this case. And because the last aligner is 22, 10 more aligners, I might just rely on the AI just to check every stage and my DM champion just going through the case. And I won't actually look at the progress of the case. So that actually saves a lot of my time. Yeah. And because it can get quite cold sometimes if you forget to sort of check in with the patient. So the virtual appointments are a good place and time for me to actually have a human touch. I might just call the patient, or I might just send a personal message, personal email. I mean, there's so many ways you can do it, give additional motivation. So at least the patient knows that, hey, Dr. Ronnie is still in charge of my case. He's still looking at it. But that's the way I do it. Okay. I'm not saying that's the best way. It's definitely not the best way for sure. But that's the way I'm comfortable with, because I know there's a lot of other clinicians who have a lot of different workflows, and some of them are really amazing. And when I visited some of the practice, the way they have the patient flow, it sort of really blew my mind. But this is where I'm comfortable with, and so that's why I'm just sharing with with the audience here, so-called my risk appetite. And if it's a complex case, meaning that if there is severe crowding or if there's extraction, then I might actually do a virtual appointment every 4 weeks. Yeah, or every 4 aligners. Yeah. Okay, enough of virtual appointments. Just some quickly, I'll just run through managing unseats. This is just one case, pretty nice case. Let me just play the video, and this is the dashboard that we see is on the web. I'm only showing part of it because of PDPA. We can't show you the patient. But just a quick few things before I go into the case. You notice all the numbers here. This basically represents every single aligner the patient has been wearing, as well as the date and the duration that the patient is wearing for, because every time you click on it, a date is shown. Yeah. So for this patient, I'll just go down to on the aligner 27 on the 14th of September. And at that time, you can see the aligner is still fitting quite well. A very small bubble developing at 4.2. And then when patient moved to aligner 28, you notice a red box. So this is when there is a notification from the AI, from dental monitoring, saying that there's a slight unseat at 2.42. And then depending on your practice, you may choose to ignore, or you may choose to maybe send a message to the patient. So every practice has a different philosophy. That's when you can customize under the protocols. But for this case, just to illustrate, we just ask the patient to continue. Some advice to use more chewies, and by aligner 28, you notice the gap is about the same or just slightly smaller, and we chose to continue monitoring. So you can see the progress all the way till today, 20th. So aligner 51, if you notice, the fit at 4.2 is still pretty good. Yeah, but instead we are getting some errors. Aligner 51, a notification saying that now 1.4. There's a slide. Okay, so that's quite an interesting case. I would say in the past, I probably would have ended up calling the patient in halfway through additional aligners or refinement. But with the aid of DM, we were able to identify the problem really early and sort of motivate the patient. And the patient knows that you're watching, so compliance really goes up. So one more case dealing with unseat as well. At stage, you can see the canine. The canine is actually not fitting too well. Gap is opening. And then again, we get a warning. So here we started to coach the patient, make sure you wear elastics, make sure you bite on the chewy, and 10 days later, voila, you can see the aligner is fitting a lot better in this case. Okay, just to share one more case here, another short video. This is a case where it's quite interesting. You just look at we took quite long during this time because the patient was traveling, but let me just This case is to illustrate how we were able to troubleshoot a liner that was actually, looking back, likelihood not manufactured well. But patient was one who was traveling quite a bit, and you can see at even at aligner 6 and 7, The fit in front wasn't excellent. We had some issues with compliance for this patient, but when she went on to aligner 8, you can see that the fit was really bad. And because of the previous history, we thought that maybe between aligners 7 and 8, patient was not wearing the aligners enough. So we asked her to continue, and she was also very busy at that time. So went on for almost a month, and she did another scan. The fit is slightly better, but we still couldn't get it to fit really well. And so we kept her at aligner 8 for quite a while. And then finally, at this time, you can see that the fit is a bit better here, but still there was quite a big gap here. The lower is definitely much better fitting. So in the end, we felt that it was a bit too long, so we asked her to move on to aligner 9. And lo and behold, at aligner 9, you can see that the aligners are fitting really well. The lower is a bit off fit again. Notice all the bubbles. We kept on reminding the patient, and you can see the latest scan right now, both upper and lower aligners are fitting really well, except maybe for the 3-4. So it's an interesting case. We were able to do it without having the patient coming in. And then right now, of course, we are in the middle of the circuit breaker, so we'll probably have to send more aligners to the patient and continue to monitor. Okay, and then lastly, just want to share just a complex case. 4-bar extraction, which previously I don't enjoy doing extraction cases. I try not to extract, but in some cases, definitely you have no choice. I mean, aligners, Invisalign has quite a good extraction protocol, but depending on the patient compliance, depending on the root length, depending on elastic wear and things like that, very often I find with extraction cases, we get dumping of the teeth, a loss of what we call anchorage as well. Case where we did an extraction, and you know, in extraction cases, there's usually a high tendency to off track if the patient is not very compliant, and you get things like dumping and loss of anchorage. So
Sorry,
notice
repeating myself. Yeah.
Here she went from aligner 5 all the way through to aligner 37. These are the photos taken by herself on 27th of March. I'll just quickly go on to the clean check. You can see that this is a clean check here at stage number 5, and I'm just going to press play so that you all can see it's basically quite a straightforward extraction case, reciprocal retraction to close the extraction spaces, and that's the end at aligner 38. And then if you look at the next clean check, this is
refinement.
Yeah, the refinement at 0, and I'm just going to play the final refinement. So you can see during refinement stage, we are just trying to settle in the bite. There is a pretty nice inter-incisor relationship. So let's just go back to the dental monitoring so we can compare. So this is the stage number 5, extraction stage, and which is actually extremely close to the real life scenario of stage 5. And then when we go back again to the monitored part, and then we go on to the area beginning of, this is towards the end right now, and you compare that to the current clean check, you can see that it's also actually very close. Yeah. So in this case, it really went really well for an extraction case, because we could see everything that was happening. And if there was any time there was loss of anchorage or there was a bit of dumping of the incisors, we could have slowed the treatment down, get the patient to wear the aligners a bit longer, or maybe even come in for a refinement. Okay, so Rebecca, at this point, oh sorry, Vivian, you're the host, right? At this point, are there any questions which I need to answer?
Yeah, there are 2 questions from Dr. Poon.
Yes.
One is whether you're using the box or the retractor.
I only started using the box more recently. Yeah, mostly retractors. You can see most of my slides, the blue retractor. So when you see a blue color retractor, you know that it's just the retractor and the phone. If you see a gray one, it means it's a scan box. Yeah. So right now, yeah, I really like the scan box. The only problem now is I think trying to bring in a scan box is quite difficult and quite costly. So I think Rebecca is trying to work out something like sort of mass buying for all the doctors in Singapore. Basically, the freight cost is quite high. Yeah, But yes, I would definitely say that the scan box is pretty good for patients who have two left hands. Yeah.
Okay, we got a few more questions.
Yeah.
Why do you think aligner 8 didn't fit by aligner 9 was okay?
Yeah, so I did put there manufacturing problems, question mark. I'm really not sure. I mean, the problem is before that, patient didn't really have a good compliance. And you notice there was like 2-3 months gap from aligner 7 to aligner 9. So a patient claims that she's wearing it every day. Yeah, so I really don't have, I mean, I'm sure some of the audience has the answer in your mind. But for our case, I still feel that could be the manufacturing fault. Yeah, because 9 just went in perfectly the first week she tried it on. Yeah. I'm not sure whether that answers the question. If it doesn't, I think the participant can feel free to follow up question on that. Yeah.
Okay, 2 more questions. How many aligner cases do you have with DM?
Oh, okay, more than 100. Yeah.
All right, then the last one is, how can we purchase the scan box from Philippines? That's more a question from Rebecca.
Yeah, I think you can
Maybe
get.
we can get
So
back
Rebecca will give a short presentation at the end. It's a product called SmileMate for virtual consultation. So that's not allowed in Singapore. So I'm not going to cover it at all. So I'll pass that to Rebecca, and I'm sure she'll give out her email. Yeah.
Yeah, maybe we'll answer that at the end of this presentation.
Sure.
We got another question from one more doctor.
Yes.
What do you do about IPR? At the moment, our practice is closed in England, and I'm avoiding sending patient aligner 5 as based on clean check. She needs IPR between 4 and 5.
Well, that's probably a tough one. If you go ahead, then you definitely get crowding and the aligner might misfit, and then you probably need a bit more time. So I guess the answer to that would depend on a case-by-case basis. If it's a minor IPR and there's not much movement left on the area, then sometimes you could probably just risk it and just leave it a crowded area there. The aligner will still work on the other areas, and then after the so-called lockdown is over, you can come back and then maybe do a additional aligner or refinement. If not, then you probably need to switch the patient to nighttime wear. That's what we do. So some of my patients, I tell them, I'm sorry, we are stuck here. We can't do anything. Just wear the aligners at night. They can easily last 3 months, just night wear. You sort of take a aligner holiday. Yeah.
Okay. 2 more questions.
Yeah,
one
sure.
from Dr. Chu. He's asking, when do we start to scan? Last day of the aligner, then wait for the DM report. Is that it?
Yes, normally if you're on the 10-day protocol or 7-day or 12 days, so at the end of the 12th day or 7th day, then the app will automatically send a notification to the patient to scan. And then after it's scanned, it's uploaded to the cloud, the server. And normally the next day, the patient gets a response, whether to change the aligner or to stay on to the aligner. Yeah.
Okay. Let's take this as the last question for the time being. So this is, without the scan box, how did you ensure good quality photos from the patients? Also, without the scan box, does it mean that there's no AI function available?
Oh, the AI function is there with or without the scan box. I mean, we were not using the scan box for the longest time, and I think I would say 95% of patients don't really have a problem with scanning. And with everything else, I think practice makes perfect. So sometimes if the scan comes back, it's not too good, we will take a snapshot, just send it back to the patient and tell them, could you just stretch a bit more here or stretch a bit more there. I mean, DM has some pretty good videos, and I'll share one later on coaching the patient how to do the DM. And the initial visit, of course, when we first give them the retractors, we'll get them to practice in the clinic. Yeah, I think that's where your team member, your staff, needs to be very patient, have a nice corner in the patient, they can sit down and sort of practice with the scan. Yeah.
All right. Thank you, Dr. Yap. That's it for the time being. And over to Rebecca on SmileMate virtual consultation now.
Oh, no. I'm just about halfway. I'm not halfway through. I'm almost
sorry.
2/3 way. Yeah, but okay. Time flies. It's already 45 minutes.
No problem.
Now coming back to the real topic of today, how DM is helping in our practice. So, I mean, I can't see new patients for sure, but I can continue to at least see my current patients and still manage them, provided there's, because once you're on DM, usually you try to front load all your IPRs. Just to answer the question of the other doctor, we try to front load all the IPRs so that the patient do not come back so often, or I would batch, or I would do the staging such that we sort of stage the IPRs together. But usually I try to front load as much as we can. I'm a restorative dentist, but I do more restorative work, so I'm quite comfortable with a high-speed handpiece. So for some doctors, they prefer to actually align some of the teeth first, so that makes IPR a lot easier. So it really depends on your comfort level. But anyway, coming back to the situation now, during this lockdown, I'm still able to continue excuse me, with my aligner patients, and I still can communicate with them. And to the patient, it's still quite seamless for them. And I'm able to also do all the troubleshooting, just to share some of the problems that we've been facing during this period. So one is, of course, now that of the lockdown period, then we have to try to make the aligners last a bit longer. So in fact, this is just yesterday, right? The day before, just yesterday. So 2 days ago, we actually had in the newspapers, that's how our local government works. They speak to some experts and they soft sell to the population that experts say you need to lock down another two more weeks. But then today the Prime Minister went up and said it's locked down for another full month. So it's until the 1st of June. Yeah. So this case, we actually did it the day before, and I compared. I realized that she was on aligner 12, and there was just a few more aligners to go. So what we did was we asked her to switch from a 7-day, if I'm not mistaken, to a 10-day protocol. I hope you're well. As you expect the circuit breaker to be extended by another 2 weeks, this was yesterday, you're modifying your aligner to change to 10 days. But then now there's another 6 weeks, so tomorrow I'll probably need to go back, or even from home, just log on and then count again the number of aligners and how long it lasts her. So I'll probably switch her to a 14-day or maybe even a 20-day protocol, depending. But I think she has another 4 more aligners, so 4 days, 40 days, that should be enough to last for the lockdown. Yeah. Okay. Yes, you realize that something like the IPR question, we can actually send them more aligners. So Singapore, most patients love WhatsApp. So my DM coordinator use WhatsApp quite often as well. And then we can actually mail the aligners to them. So this is quite convenient. So luckily, during the lockdown, we can still courier out the aligners. This is the same patient which I used as an example earlier on. So you can see that she still has about 25 aligners to go. So we were able to send her, and I think another 10 aligners to just keep on going. Yeah. One of just a quite recent example, my patient had a dog that loves aligners. So aligner number 9 got chewed up. You can see the notes. So now she's on 10. Yeah. So what we did was we asked her, please, can you scan number 10? Okay, you can send an emergency scan. Means you can ask the patient to just scan tonight or this evening. Yeah. And then this was the scan, came back. Fit is okay. Yeah, this was back in February, just as the COVID was starting. And then unfortunately, she has not been a very good patient. You can see she's still stuck on 10, until now. Yeah. Recent case, Butland dislodge. You can see that. Yeah. So what we did was she can't come in. It's not considered urgent. So we told her, we made a little photographs and we explained to the patient, you can actually do a little cut using a clean nail cutter or scissors, cut a small slit. And then after that, you can still hook your elastic and you can still continue to wear your class 3 elastics for these patients. Yeah. Okay, so that's how we sort of try to move forward ahead. Moving forward, what can we do? I think one question in the audience will be those of you who are not on DM and they're saying, well, I've got quite a lot of patients on the aligners. What can I do? Can I ask them to use their handphone and try to take a photo and things like that? You can, but in response to this pandemic, actually dental monitoring has been working really, really hard. They have launched quite a number of products within the last 2 weeks that will actually help you a lot during the pandemic, depending on which country you're in. But definitely this is already available, what they call photo monitoring light. And it doesn't use AI, it just helps the patient to take a photograph of the teeth with and without the aligners. So you're now able to then remotely check on the oral situation, and you can actually communicate with the patient basically through the app. And because the app is able to play videos, is able to then explain to the patient exactly how to take the scans. And I'll just share one of the videos with you.
The first picture is the front view of your teeth. Lie down on your back teeth and smile. Pull your lips and your cheeks back as much as you can. Then take a close shot. The next picture is your right side. Lie down on your back teeth and pull your cheek and lips as much as you can without hiding your gums. Make sure you angle the camera so that your back teeth are visible. Same thing on the left side, just the opposite. Bite down, pull your cheek and lips away without hiding the gums, and ensure that your back teeth are in the shot.
Okay, so this is what the photographs comes back. So this is a patient that we completed a while ago, and then she had some surgery done and she stopped wearing her liners, her retainers. So she wanted us to check on the fit. So we sort of sent her a request to do a scan. You can see her fingers, but it's pretty clear, you know. And with this function, you can also ask the patient to scan the occlusal view. So you can actually have quite a relatively good view of what's happening in the mouth here. Because for her, she had a wisdom tooth removed and she was afraid that the aligner wouldn't fit. But you can see actually it's fitting quite well on the molars, and we were able to assure her that it's okay. Some bubbles here, just need to wear your retainers full time again for maybe another 2 to 4 weeks. And you can ask for another scan just to make sure everything is fine. So it's a nice tool to have. Photo monitoring light, you can get more details from Rebecca. And what can I learn from this for the future, especially after going through this or going through the pandemic right now? Definitely more patients on DM. Sometimes I'm still quite selective. Some short, simple cases I might skip. But now I think going back, I would actually put almost all of them on dental monitoring and definitely give them as many aligners as possible. And I'm trying to do more appointments on demand so that I'm saving up a bit more chair time. We're trying to digitize more visits. Remember in the beginning I showed Loom, and trying to use that maybe to save the patient 1 or 2 more visits to the practice. One of my DM coordinators having a baby, so maybe we can work out something for her. She can work from home as well as on a permanent basis. And for those of you all who are outside Singapore, as you know, the next big thing in dentistry is, or rather it's a big thing now, is virtual consultation. And DM also has a software called SmileMate. And I think Rebecca will talk a bit more about SmileMate, because I have not actually used the software, because here we are not allowed to start a relationship with the patient online, whatever that means. Yeah. Okay, so remember in the beginning I was showing you the photo of my practice. So this was just about 2 weeks ago, and middle of night someone sent me a video, and there's actually a fire going on, and you can see the smoke coming down from the top floor. It was on the 17th floor. The fire was so bad that it actually, smoke came down to the ground floor, and then the windows cracked and it burst. And the problem was my building is so old, there's no what they call water sprinkler system. So very fortunately, they were able to get the fire under control. But that got me thinking, because my practice is just on the 5th floor. And what happened if there was a fire in my practice and all the aligners got burned? It'd be a nightmare to actually do additional aligners and restart all the cases. So because of that, I think it's a good idea to also give as many aligners as you can to the patient. So with that, I will end my presentation here. Thank you very much for taking the time to listen in. I will be here to take more questions. What we'll do now is maybe I'll pass it over to Rebecca to talk a bit about SmileMate, and you all can continue sending your questions, and then we'll continue after that with the Q&A. Please follow me on Instagram or email or Facebook Messenger. And just a little bit of plug for myself. We do have a teaching academy. Website is below, adda.sg. All right, so stay safe, everyone.
Thank you, Dr. Yap.
So thank you for your time now, but don't go, everybody, because as what Dr. Yap mentioned, Dental Monitoring just recently launched a new product called SmileMate. I just want to show you a quick video for everybody. So afterwards, you can come back to me and any questions about this product, and then stay till the end because I believe some Q&A section will be ongoing as well. So let me share my screen. Are you all able to see my screen?
Yes.
Okay, cool.
We want to talk to you about remote assessment of your patient's dental, oral, and orthodontic conditions. Did you know a reliable solution for virtual consultation existed? No? Don't worry. We're here to help you get started. Welcome to SmileMate Virtual Consultation from Dental Monitoring. With SmileMate Virtual Consultation, dental professionals can conduct patient consults remotely. Get started at any time. Our self-service virtual onboarding will provide you with the resources you need to remotely assess your patients for the first time using our lighter, more simplified version of SmileMate. All at no cost to you. Here's how it works. Simply install our plugin on your practice website. This allows your patients to instantly create their user profile and take their own intraoral pictures on their smartphone. Next, a comprehensive, customized report, which can detect over 20 categories of oral health, is automatically generated and sent to you for review. Cool, right? You can qualify your patient's needs in their SmileMate portal, sharing their comprehensive report and your professional advice, as well as a booking link if an emergency appointment is needed. Plus, our embedded video conference feature allows you to speak to your patients directly on Vizio. SmileMate Virtual Consultation is here to help you remotely assess your patients with ease. Free until the end of May.
So thanks for watching the quick video. What I just want to introduce about SmileMate is absolutely free for everyone. I know Singapore is having the difficulties with the. Oh, so sorry. I have to close this first. Okay, there's someone is on the. Hang on. How do I close it? I have to stop sharing. Yes. Have I stopped sharing already? Yes. Okay. I'm sorry. I'll just come back again. And I just want to mention about the SmileMate virtual consultation. Absolutely free for everybody, except I know Singapore having the local rules. So basically, everybody please check your local regulations. Otherwise, it's free of charge, unlimited patients on your virtual consultation for free to use until end of May. So any questions, please come back to me. I'm very happy to help you guys to set up virtually on your SmileMate as well as your dental monitoring. So perhaps we can have some questions and answered by Dr. Yap right now.
Yes, there was one question asking if patient can pay by bank transfer, Dr. Yap.
Yeah, I just answered that. For existing patients, yeah, definitely. I mean, let's say they're halfway through and you want to send them more aligners, it's tracking well. You can always say, yeah, we need progressive payment before we can send you the next few aligners. Yeah.
And last one is, do we get an e-cert for attending this talk? Dr. David Yun. I tried to ask. So Ryan, can we do something? I will check with headquarters. Yeah, nice one.
Yeah, we can try and get you one.
And I'll ask Dr. Yap to sign.
E-sign, yeah.
So any more questions from the audience?
It's fine if not. You can always write to us on support. We will send you an email afterwards, and then you can send your questions to us, and then we'll make sure that is replied one after another. If not, then you can visit our DM Academy website for the rerun of this video on demand. So if there are not too many questions, then we will end it here.
Okay, stay safe, everyone.
And our biggest gratitude to Dr. Yap for the very great presentation. Thanks, Dr. Yap. Yeah.
Thank you, everyone. Thank you for all your very kind comments as well. Yeah.
Yeah. Thanks.
Thanks. See you.
Okay. Stay safe.
Stay
Take
safe,
care.
everyone.
Bye bye.
Bye.